to do is talk to you a little bit about how we look at knees, patellofemoral problems, and especially ACL, because those are probably the most common things that you're going to deal with. I will touch a little bit on MCL, PCL, but the primary focus is going to be those two things. So to start off with, just looking at the extensor mechanism, because it relates to both. You obviously have the rectus femoris. The most important thing with that is it crosses the hip as well as the knee joint. So that's particularly important when you're doing that stretch. And one of the most important things you want to understand is most people, when they do a quad stretch to warm up, they're going to grab their foot and grab it. This is great for stretching the distal component, but where people tend to be tight is the proximal aspect. So when they're doing this stretch, one of the things that you want to emphasize is have them take up that proximal component first, then either with a strap or with some assist to pull that leg up. Now the thing you have to understand, we've talked about this before, that psoas, which is one of the things that you're trying to stretch, is shortened when you arch your back. So when people drop forward and they go to grab their foot and they're arching their back, they're putting it on slack. So you want to emphasize having that slight forward lean, keep that trunk in extension when you do that. But again, we're getting the psoas as well as that rectus femoris. The vastus intermedius sits underneath. An important muscle sort of gets lost in between everything because it's underneath. The vastus lateralis, the largest quad muscle. It's always going to dominate when it can. So if someone has a strength imbalance, the lateralis is going to kick in. If they have hip weakness, the lateralis is going to kick in. The lateralis is constantly working. Even when someone's knee is trashed, the lateralis is active. So as a result, that's where people have a significant amount of tightness. As they have ITV issues, I can guarantee you their lateralis is tight. One thing you want to remember, that's what you're really hitting with the foam roll. Make sure you do that. The medialis, that's the balance to the lateralis. It's the only muscle that has a medial pull on the patella. And when we stand, and this is more prevalent in females, our hips are wider than our knees, and as a result, we have this diagonal alignment. We're always going to pull that patella laterally because of that attachment of the quads laterally. The only muscle that's going to pull that patella medially is the VMO, the vastus medialis oblique. Those fibers, they change. Proximally, they're a little more parallel with the thigh. Midway through the muscle, they have a 45-degree alignment, and then down below, they drop even a little bit further. But that 45-degree alignment is the one that you want to try to visualize. So as a result, it's pulling that patella medially. Now just understand, you have 3 other quad muscles working against that VMO. When that VMO is not developed, it's going to contribute to patellofemoral problems. If that VMO, you have to look at strength as well as timing. If it's late to come in, it's not going to be able to stabilize that patella. What will happen is that patella will track laterally, and then the VMO will try to hang on, and it's not going to have the power to try to balance that. So the timing as well as the strength is important. Whenever you have injuries like contusions, falls where you hit the knee, it takes a third of the amount of swelling to shut down the VMO than it does the rest of the quads. So even if someone has just a little puffiness around their knee, that VMO will be inhibited, it will be shut down. They've done studies where they've taken guys, they've done this in the military because they can't say no, so they just inject their knee with saline, and it takes very small amounts of swelling to shut down that VMO. They've measured it through EMG activity, whereas it takes large volumes of fluid to actually shut down all the quads. So low-grade swelling, you're going to run into a problem. Again, like I said, with contusions, falls where they bang the knee.
Is that why most patella dislocations are lateral dislocations?
Yes.